Well, good morning. My name again is Lauri Beck, and I am the President and Chief Operating Officer of Insurance Network America. Glad to have you with us this morning while we talk about your future under healthcare reform, the Broker's Survival Guide to PPACA. Before we start, I just wanted to remind you again, it's been about 18 months since this bill was passed, and we're still awaiting final rules on so many pieces of this massive bill. It's almost impossible to stay on top of it all, and yet it's coming at us at lightning speed. Now, in the interest of full disclosure, I want to share a couple of things that you need to know about me. First, I'm a fierce opponent to PPACA. Now, that said, I am not opposed to a Patient Protection Act that actually help make care more affordable. But this massive bill, in my professional opinion, falls so short of that, it'd be laughable if it weren't so worrisome. And I think we all agree that we need more affordable health insurance. You're on the front lines of that every single day. We know we need more affordable care in this country, but we, in my opinion, did not need this mess to accomplish that. Yet it is what we have. So now what? I'm often asked if I think it'll be repealed or shot down by the Supreme Court. The honest answer is, I just don't know. But most experts agree that it's so far out of the gate that even if it's pulled back in 2012 or 2013, permanent changes to our system will remain. Now, as professionals, I believe that means we have to be prepared for the worst, even as we hope for the best. Now, I promise to speak to you today about a survival plan amidst all of this chaos, but first, I'd like to walk you through the last 2 years, the next 2 years, and the changes that are coming rapidly our way. So first, let's go back and look at 2010 and some of the things that already have taken place. We saw the lifetime and annual limits removed on essential health benefits, changes in the way children were treated on the plans. We saw this massive list of preventive services that came out for free for all non-grandfathered plans. We saw the funding of the federal temporary high-risk pool. Small business tax credit was implemented, and we saw a new appeals process for coverage determinations and claims. 2011, the new regulations included the federal and state oversight for quote-unquote unreasonable premium increases. Minimum loss ratio requirements kicked in that we all know have created real chaos to those of us that are out there in the market. We saw increased penalties for non-qualified health savings account distributions, changes to flexible spending accounts, and the establishment of the exchanges began. 2012 and 2013 are going to be relatively quiet for agents and employers, but carriers in the states are going to be scrambling behind the scenes. Some things that are coming in 2012 are the W-2 reporting requirements for employee benefits. Now, this is for all employers of 250 or more will have to report the value of the employee benefits they provide to their employees. This is not at this time to tax those benefits. It's really, according to the IRS, for informational purposes only. 2012, plans must provide standardized information about benefits and coverage. Now, I saw today that there has been a implementation delay on this, in part because the Health and Human Services has been relatively slow at providing details to the carriers on exactly what these 4-page summaries have to include. Silly questions like, at one point it sounded like it had to be in full color, and now it sounds like it doesn't have to be. Bottom line is, still a lot of questions on what these summary of benefits and coverage have to provide, and today they did come out and offer us a delay in implementation and no real date on when the carriers will have to comply. 2013, the state exchanges are going to have to meet progress testing requirements in order to continue along the path and avoid federal takeover. Also in 2013, insurers and employers are going to have to start getting ready for the oncoming exchanges. So insurers are going to have to be ready to comply with the rules HHS has set down to determine electronic eligibility for applicants under the exchange subsidies. And employers are going to have to start notifying their employees of the availability of those exchanges, and their possible eligibility for the subsidies under the plan. All of this is leading to the full implementation of PPACA in 2014, where the world as we know it today will cease to exist for insurance agents, insurance carriers, many providers, and for all of our collective clients. Now, here's a question for you. Is anyone else finding it hard to believe that Thanksgiving is day after tomorrow? Or that Christmas is just a few weeks away? Are you in the same place as me where you feel that the years are just flying by? Imagine then how too fast 2014 is going to come at us. Well, here's a glimpse into that future. So 2014, unless they get shot down, we have the individual mandates to purchase minimum coverage. Employer mandates for those who have more than 50 employees, not only will they have to provide what's considered minimum coverage, it'll have to be affordable for their employees or they'll face stiff penalties. All fully insured plans must be guaranteed issue. No pre-existing condition exclusions will be allowed for anyone. We'll see price compression mandates, which will take the rates to a 3-to-1 maximum for fully insured plans. Now, some of you are already in community-rated states, so you may be wondering, will this be any different? The answer in almost every state is yes. Also in 2014, we're going to see new federal taxes on insurers offering fully insured plans, massive expansion of Medicaid. Medicaid is expected to see an increase on January 1st, 2014 of an additional 16 to 18 million enrollees. Health insurance exchanges are going to be fully operational at a state level or risk federal takeover. We're going to see substantial subsidies kick in for the purchase of private health insurance, and small business tax credits that went into place in 2010 will increase to 50%. So looking at this slide, what do you think? Given what you see here and your knowledge of the mandates that have already kicked in, are health insurance premiums going up or down? Well, most experts agree they're going up, way up for most Americans. But one segment of Americans is expected to get hit the hardest. Can you guess which one? Well, it's the young and the healthy who are fully insured, in great part due to the price compression that will be part of the new community-rated world we'll be living in then. Because as you can see here, if a carrier needs to charge for its oldest, sickest insured members $1,000 a month, and believe me, they're going to need to be charging more than they are today based on all of the mandates that have kicked in. But if they need $1,000 a month for their oldest and sickest members, they can't charge less than $333 for their youngest, healthiest members. Now, there are a lot of additional predictions about what's going to happen to the fully insured market when all of this takes effect. But most of the models show a deteriorating market share for all but the largest carriers in the small group fully insured space. Besides the things we've already talked about and other threats to you, one of the things that's also going to really impact you and mid-sized carriers in the small group fully insured space are these health insurance exchanges, which we're going to talk about in just a minute. So let's look at a couple of things. And I'm not going to spend a lot of time on this because the bottom line is health insurance exchanges is probably a full hour or more of a webinar all by itself. And if it's something that you're interested in knowing more about, I'd suggest two things. One, our staff at Insurance Network is very well educated on a lot of the information coming out of PPACA. So reach out to your employee benefit specialist here on our team and ask them for more information. If you really want a lot of additional information and you'd like me to do a webinar on exchanges, I'd be happy to do that too. So anytime you have an idea of something you'd like me to expand on, just shoot me an email, let me know, and we'll work to put that on the agenda. But bottom line is, here's just kind of a high-level view. Each state is going to determine, first of all, if they want to have a state exchange. If they do, then they get to decide which plans are going to be available inside and also outside of their exchanges. State exchanges must be fully self-sustaining by 2015. So states are currently being offered the ability to apply for grants, and they're substantial grants. In the state of Idaho, we were eligible to apply for a grant in the excess of $30 million. Big grants. But the grant money is all going to go away by 2015, and at that time, these state exchanges must be fully self-sustaining. Benefits offered inside the exchanges, although the state gets to determine which plans are available, they're going to be heavily regulated and restricted on what they can and can't allow. An example on some of the benefits that must be offered on the plans inside the exchange is that an individual deductible will be capped at $2,000 for any individual age 30 or over. That's right. So if somebody wants to buy a plan inside the exchange and they are 30, they will not be allowed to buy a plan that has a deductible of more than $2,000, and it's $4,000 for a family. Now, there are some catastrophic plans that will be allowed, catastrophic, anything over a $2,000 individual deductible. But in order to qualify for one of those plans, as the law is currently written, you'll have to be 29 or younger. These exchanges will be the processing centers for determining eligibility for the PPACA subsidies as well as Medicaid and S-CHIP. They're not just going to be the kayak of the world or the Expedia of the world for health insurance. It's true, you're going to be able to go to the exchange and see a side-by-side comparison of the plans available inside the exchange. But behind the scenes, there's more to it than that. The exchange is going to be the processing center for determining eligibility. It's also going to be the conduit for the subsidized premiums. In other words, individuals are going to go to the exchange. They're going to fill out information about their family, their income, their health. They're going to go complete all of this, and then the system is going to look out to see whether or not they're eligible for Medicaid, S-CHIP, or a PPACA subsidy. Now, the prototype for the state exchange is the Massachusetts Connector, and you should know that in Massachusetts, it's a 12-page form to determine eligibility. So this is not expected to be an easy process. But as with all things required by the government, it is what it is. But you can see why the grants for these exchanges are so substantial. Can you imagine the IT work that has to go into making sure that all of the moving parts actually function correctly on January 1st, 2014? Particularly when you imagine how many people are going to be driven to the websites on those dates to see whether or not they qualify. So what is the impact to you? Well, inside the exchanges, it's important that you understand that there is currently no established mechanism to compensate you for your role as a navigator inside the exchange. Carriers are not allowed to pay insurance commissions to the navigators, and the navigators are the only ones allowed to help people with these plans. Now, it could still happen, but if it doesn't, you have to ask yourself how many of your current clients are likely to go to the exchange for their coverage. And here are just two of the reasons why they might. The first, in order to receive a PPACA subsidy, an individual must purchase a policy on the exchange. Second, to be eligible for the small business tax credit in 2014, the employer must purchase the group policy on the exchange. So, from an individual standpoint, let's take a look at the subsidies. Well, based on the current legislation, an individual will be eligible for a subsidy if their family income is at or below 400% of the federal poverty level, which, as you can see, for a family of 4 is $88,200. Now, there are several calculations that go into determining the subsidy, but to give you an example of how this would work, let's assume that the eligible plan in the exchange charged a premium of $12,000 for family coverage. $1,000 a month, $12,000 for family coverage for the year. And let's assume that premium credits were currently available for the individual that we're discussing. A family of 4 at 100% of the poverty level, this $22,050, would be eligible for a credit of $11,559 of that $12,000, leaving their annual share of the annual premium at $441. $441 for the entire year for that $12,000 plan in the exchange. Now, I'm not going to argue whether or not somebody who's only making $22,000, family of 4, perhaps they should be eligible for that type of a subsidy. And in fact, the way the Medicaid rules stand today, they wouldn't be in the plan anyway because they would be eligible for Medicaid for the entire family. But let's take a look at another side of this. Let's talk about this 400%. Family of 4, family income, modified adjusted gross income, by the way, of $88,200. Now, the subsidy adjusts as the family income increases. So at that top end, a family of 4 for that $12,000 plan would be eligible for a credit of just over $3,600. That's a $300 a month credit. So their annual contribution for a $12,000 plan would be $8,400. But here's the question. How many of your clients would find a $300 a month credit enticing? And if the exchange is the only place they can get it, and if the exchange has no room to pay you for that sale, where does that scenario leave you? Well, I think it's scary. So now what? Well, let's face it. The things I just showed you will impact your business, and they will impact your revenues. Most likely they already have. And we're still 2 full years out from full implementation. So what are your choices if you currently rely on small group and individual health insurance commissions to fund your lifestyle and to pay your bills? I believe you have 3. Option 1 is give up. And unfortunately, some of you will. Some of you are either so close to retirement or you've just kind of had enough and you'll get out of the business and find a new career. Others of you, I believe, will do nothing. You'll change nothing. Hope that this is all just a dire prediction and it'll all go away. Trust that it'll be repealed or significantly changed, that somehow common sense and logic will prevail, and frankly, I hope you're right. But unfortunately, if that describes you and you're wrong, you'll most likely be out of business in less than 3 years. Again, just my opinion. But I honestly believe that as a group health or individual health producer, if you always do what you've always done, you'll no longer get what you've always got because the game has changed. So choice 3, and this is important, the rest of you, those of you who embrace change and take charge of your careers will absolutely, in my opinion, see success like you've never seen before. And the great news is you don't even have to significantly change your business model or the services you currently provide your clients in order for that to happen. Before we talk about some of the specific strategies, I want to just give you some food for thought. And I say this in all sincerity. I really do believe there has never been a better time to be a consultative benefit specialist. In other words, a quality health insurance agent. So why do I think this is a great time to be a health insurance agent? Well, first, mid-sized carriers are diversifying their products, and they need agents to market them. In particular, carriers are coming out with alternate funded health plans in rapid fire. And we're going to talk in a minute about why that is, but trust me on this, it's a great market, and if you're not already there, you can have a lot of fun with it while providing tremendous benefits to your clients. You already have the relationships. All you need to do is leverage them and make sure no one else is in your house. You can't afford to leave money on the table anymore. And why should you? You don't even have to be the expert at the new markets you expand to. You just need a partner with an organization with the expertise to show you how to write products that you may be walking away from today. For example, at Insurance Network, if you're currently walking away from life insurance opportunities with the business owners, such as the buy-sell agreement, the key man policies, I've got a life team here with client-ready kits for you to go out and start maximizing your opportunities in that market today. Remember, employers are desperate for your assistance, and nobody is better equipped than you to help them. And when you do provide that value, you are in a position where you can and should be compensated accordingly. Now, maybe that means you're making plenty of commissions from the products you're able to place for them. Maybe it means you need to set yourself up to be able to charge a consulting fee for your services. One of the things that I really want you to do today is pick up the phone and call the Department of Insurance. Ask them in your state, what are the rules for an insurance commission-paid person to also receive a consulting fee if you assist your clients with things like PPACA compliance? So pick up the phone, call them. In some states, there is no additional licensing needed. In some states, you just simply have to offer a disclosure to your client, and you agree to a certain amount. They pay it, you're done. Some states do require additional licensing, so make sure you know what the rules are in your state. But either way, at the end of the day, seize the moment, because believe it or not, there are a good number of your peers and competitors who will be out of business in 2014, either by choice or because they refuse to adapt. But those of you who are willing to embrace change, there are customers who are going to need a new agent, and it can and should be you. So how do you embrace change? Well, you're going to have to be more consultative in your approach. And in doing so, you're going to have to uncover all of the needs of the individuals you serve, and for your group clients, of both the employer and the employees. So let's shift gears for a minute, because I often get asked whether or not I believe that as a group health insurance producer, you should simply get out of the market. I told you I've got life specialists prepared to help you write life insurance for those same clients. So is that what I'm saying? Am I saying that the group health market is dead and that you have to stop selling group health insurance and move on to other markets? Absolutely not. Now, I already told you that many of your customers are likely to consider a move to the exchange. I know as well that there are a lot of predictions being bounced around whether or not all employers are just going to send their employees to the exchange and wash their hands of benefits altogether. Now, let me ask you a question. I know you can't answer me online, but just think about this for a minute. You're the ones out there working directly with the employers, so you tell me, why do employers have employee benefit plans? Why do your clients purchase health insurance for their employees? In most cases, it is how small employers compete with larger employers for key employees. It's how small employers retain their best employees. And does sending them to the exchange where the employee will see no correlation between their health plan and their employer accomplish that? I don't think it does. You know, if I today were to go to our 30-some employees and say, here's $300, here's $500, whatever the amount of money is, go to the exchange and buy your insurance. You know, probably for the first 2-3 months, they would remember that that pay increase I gave them to purchase health insurance tied me to their employee benefit plan. I honestly believe 3, 4, 5, 6 months later, they would then view that as just simply part of their pay package. It'd be a pay increase. It would be their wage. They would no longer see me as the one providing them with the health benefits. And I believe most small employers are in the same boat. However, cost is still the driving reason employers often do throw their hands up in the air and give up. So now that we've talked about how the premiums for fully insured plans in the exchange are most likely going up, especially for healthy groups, in other words, really pushing that cost equation, pushing that employer against the wall, What if we talked about a health benefit package that would allow an employer an affordable option? And what if it were one that you were still being paid well for? Well, a strategy that may very well work for employers of 10 or more lives is self-funding. So let's talk about that for just a minute. And let's talk about what is all the fuss with self-funding and how does it accomplish that? Well, within PPACA, there are some key differences in the rules for fully insured versus self-funded plans. One is the avoidance of minimum loss ratio requirements, which, as you may know, are creating an incredible amount of havoc, particularly for mid-sized carriers who are currently offering fully insured plans but have a much higher expense ratio than some of the larger carriers. Two, no community rating. Community rating on fully insured will drive the cost up for younger and healthier groups who happen to be the best candidates for alternate funding. Ability to set the commissions. You get paid for what you're worth on a case. When you bring a consultative solution to your client and you're able to show them what these plans can really do for them over the long term in particular, you have the right and the ability to charge what you're worth. And because there are substantially fewer mandated benefits, not only under PPACA, but often these plans are also not subject to state mandated benefits, you're really able to create a flexible plan design for the client where they get to design the plan they want. You're also going to get the data you need to help that employer drive informed decisions. You're no longer going to just get this renewal at the end of the 12 months. You're going to get all of the details you need to talk about utilization, what benefits are important to the client. Are they using the copay? Are they using the drug card? Are they using name brand or generic drugs? All of the data you need. You're going to be able to help employers develop strategic wellness plans and truly finally take a long-term perspective, a true strategic approach to managing their costs. And again, something that's important for you to understand, when you provide your clients with this long-term perspective, persistency goes up. And because persistency goes up, your income becomes more stable. Now, I want to take just kind of a step back and talk about the three primary funding options currently available for employer-based benefit plans for those of you who are less familiar with these three strategies. Now, on one hand, we have fully insured, the plan most of you are most familiar with. This is the pooled option. As you know, employers pay a set premium each month, and at the end of the plan year, even if the group has had no claims, other than the outside chance that they're now going to get a small refund under minimum loss ratio requirements, most often they don't get any of that premium back, and they will most likely still see a pooled renewal increase because that's what the world of fully insured is. No risk, no gain. You know it's predictable, and you kind of have a good feel for where it's going. On the other hand, we have the self-insured market, where the employer is totally on the hook for all of the claims incurred by his employees. Oftentimes, he uses a third-party administrator to administer the claims, and usually purchases some protection, such as reinsurance, to protect them from catastrophic years. In between, we have what we're really seeing, the surge in the market share, what we will refer to as alternate funding, plans that are specifically designed with the needs of small employers in mind. So what does that plan look like? Well, it's got one bill inclusive of all components, very similar to fully insured. It has low attachment points for reinsurance. In other words, it provides very strong protection from catastrophic claims by either one covered member or the group as a whole. Automatic advanced funding arrangement. Again, if in month one they have huge claims, they don't have to worry, like on self-funding, of getting a huge bill in the mail. Everything is predictable, even though it is under an alternate funded chassis, including the contract allowing for the runoff of claims. All of the horror stories you may have heard from large group self-funding are taken away in this alternate funded opportunity. Now, in the last 6 months at our office, we've had 5 of our traditionally fully insured carriers come out with alternate funding for these small employers. plans that meet the ERISA definitions of self-funding with the additional protections we just talked about built in to protect the small employer, with a monthly billing that looks like fully insured, but with the ability to actually get some money back if the plan performs well. And these plans include detailed reporting that, again, allows the employer and you to actually manage the plans. And to the employees, it looks like the same plan they've always had. So you might ask yourself why these carriers are coming out with these plans and why others have them in the works. The answer is simple. They're as worried as you are about the future of fully insured market if things stand exactly as they are in 2014. And they worry that their customers and you are going to need alternatives. So how do you identify a good prospect? Well, a couple of things. Note one thing, that I have the group size starting at 10. Now, I know, and we have them, there are products out there offering self-funding down to 5 lives. Personally, unless the group met a very specific criteria, I wouldn't offer a group to that size. And frankly, you know, I think that most groups of 2 to 9 lives are probably going to be the ones most likely to go to the exchanges anyway. I believe your real market in 2014, for the most part, is going to start at 10 lives. The reason I feel that is that most 2 to 9 life employers, particularly those with low wage earners, are really going to be the ones most likely to benefit from the tax credit, and that alone may push them into the exchange. Because remember, then they can still maintain that employee benefit package. They can maintain that employer-employee, look what I'm giving you relationship. But they'll be eligible for up to 50% of their premium back in the form of a tax credit. So I believe you're going to be looking for groups of 10 or more. You want employers that believe that providing employee benefits is a priority. You want those with a stable workforce, low turnover rates, groups that are financially stable. The reason I say those things is that you really want a group that is going to be able to stick with this for at least 12 months, preferably 3 years. 12 months, if you've got a group that there's any risk that they would terminate coverage mid-year, this is not a plan for them. Because even though it has substantial benefits and protections built in for the employer, in order for them to reap total benefit of those, they have to stay on the books for the entire 12-month plan year. You want a healthy group. Why? Because you want that group that can benefit from lower rates and an opportunity for money back. If it's a high utilization group, a group that might be max rated today, certainly not much benefit from them in going into this type of scenario because they're going to be at the higher end of the rate curve in the self-funded, alternate funded as well. And you're really looking for groups that are looking for the long-term perspective. You're looking for somebody who wants a strategy, not just a plan. And you want to be the person that's in there to talk to them about that. Because what we have found is that when the agents offer their clients these kinds of consultative solutions, those employers are then much more likely to turn to those same agents for other needs they have. In other words, what we have found, and I'm sure those of you who are offering self-funding right now know this, the employer just simply looks at you differently. They look at you as more of a consultant, not an insurance agent. They look at you as somebody who's solution-minded, not a spreadsheet guy. And when they do, they're more likely to ask you more questions, and you're more likely to uncover more opportunities. So what types of opportunities are there out there? Well, again, other than selling self-funding, you can also sell life insurance to solve business planning needs of the employer. Worksite marketing to provide voluntary benefits to the employees. Interestingly, even in this down economy, voluntary benefits are skyrocketing. Why? Because the employer can no longer afford to offer dental, vision, cancer, and other things. The deductibles on plans are going up, and some employees are looking for payroll deduction options for an affordable alternative to be able to subsidize some of their own benefits. Individual life, disability, and annuities, also great opportunities for you if you're out there talking to all of your clients, including the employees at the groups, about everything you have to offer. Now, one thing I want to make sure you remember is that at Insurance Network, we specialize in all of these products, as well as fully insured health plans, self-funded, and alternate funded plans. We have 25 years of experience helping agents across the country make more money, expand into more markets, and become more successful. And we want to make sure that we're maximizing that opportunity with you too. Now, about a month ago, we had a top producer summit here in Boise. And for those of you who didn't attend, I hope you come next year because it was a great event. We had 3 days of packed presentations and educational summits. And we still have some of those presentations on 2 gigabyte thumb drives available. On that thumb drive, we have presentations on alternate funding, maximizing revenues within your agency. We have a presentation on minimum loss ratio requirements from a carrier's perspective. We have, on that thumb drive, we have a presentation on there about selling life insurance to your current clients. All kinds of presentations. And if you're interested at all, when this call gets over, give my office a call. We'll throw the number up in a minute and ask for your thumb drive. We don't have a ton of them available, so make sure you call today and we'll get one of those out to you. Now, we also have sales kits, client presentation materials, more ways to help you that I can list here today. So if you're already working with our office, great. Reach out to your life specialist, your annuity specialist, your employee benefit specialist. Talk to them about your vision for the future and find out how they can best help you. If you're not working with someone in my office and you want to be, reach out to us and we'll partner you with somebody who can help you every step of the way capitalize on any of these opportunities. Now, we've been on the phone for a while and I want to let you get off, but I want to give you some final thoughts. You need to embrace where things are today, but plan for where they're going. If you're not already being more consultative in your approach, you need to be. The days of just offering a spreadsheet and saying, which do you choose? Guys, they're over. There's no way you can continue to be successful in today's market and do that. Educate yourself and never, ever stop learning. We're going to put this presentation today on the website. I know I flew through things really fast. I apologize to you for that. There's just a lot to cover. But we've recorded this session. We'll put it out on our website. Go back through, listen again. Look at some of our other webinars that are out there and reach out and find more information. Our team is ready to help you. Find somebody else that you can partner with to mentor you. If that's in our office, great. If it's in your local community, great. Just find somebody that knows a little bit more than you do about something and partner with them going forward. Maximize available resources. There are so many resources out there to you today. There are so many ways that you can just tweak your business just a little bit in order to be more successful. And as a result, have your best years ever because you decided to. Now, our 800 number is up there. I'm going to go and look and see if we have any questions on the line to see if anybody came up with any while we were there and see if we can get to those. But if there's anything that we can do to help you with anything, again, there's our 800 number. Call. I'm going to shoot you an email here in a few minutes and thank you. Probably within about an hour, you're going to get an email from me thanking you for attending. Reply back to that with questions as well. Let us help you any way we can. Okay, questions. Where did you get the premium credit amount from? The premium credit amounts, there is a wealth of resources, and I can send you to the website that has those. There are people much smarter than me analyzing the 2,700 different pages of the bill, but I can definitely give you where those credits came from. When you say $2,000 deductible at the grade or at the age of 30 or greater, does that include copays? No. They have set out-of-pocket limits separate from the deductible, but out-of-pocket limits are also being greatly restricted under the new exchanges and the plans that will be available. And I want you to remember something else, too. There's no promise there will be fully insured plans outside of the exchange. talking to carriers out there, not all of them are sure they can afford to be with fully insured plans outside the exchange. So if all you have are the fully insured plans inside the exchange and they're restricted to the way they look like right now, we're all in trouble because the plans they're designing are not the plans you're selling today. Aren't brokers going to be able to sell plans and get compensated within the exchanges? The answer to that is maybe. The National Association of Health Underwriters was successful at getting health insurance agents included to the list of who can be a navigator. But there has been no provision added for paying you. Now, the way it works today is that you can apply for a grant if you're a navigator for compensation. But if you have an opportunity to look at the list of who can be a navigator, they're unions, they're associations, they are co-ops. It'd be pretty easy for a union or an association to apply for a federal grant in order to be paid for being a navigator. I'm wondering how you're going to do that. So there's going to have to be another mechanism built into the exchanges in order to pay you, and right now it doesn't exist. So the way the law currently reads, yes, you can be a navigator, but nobody knows how you'll be paid, and that's the danger to you. All right, how many carriers have alternative funding for Nebraska or nationwide? My understanding right now in your state is 5. There may be more that I'm unaware of. I know in our office we have 3 and a 4th one coming out. So right now 3 in the state of Nebraska. And I think that is it for the questions. I'm going to go back and look and see if I have any others that have cropped up. You can type in a question over to the right-hand side of your screen if you're interested in that. And it appears, let me give you one more second to ask a question. I'm not seeing any more. Oh, are the minimum funding companies for Arkansas? Are there minimum funding? Yes, there are for Arkansas. Again, please contact my office. I believe we have 3 currently available to small group in Arkansas, and I'm sure there are others there as well. So are HSAs gone? Well, that's a good question. No, but based on the legislation as it stands, they will be severely restricted. Now, we both know that there are family deductibles on HSAs that are currently less than $4,000, and so $4,000 is the cap. There's a lot of talk back east about trying to get HSA legislation back in there and really expanding the opportunities. I personally think that that would have been a way to actually get more affordable health care, would have been to improve HSAs and improve, you know, really the transparency of cost at the doctor's office. I'm hopeful that there will be continued discussion on that, but right now the answer to that is no. Where do you think we are at for MLR versus agent commissions? I'm hopeful. If you haven't reached out to your Department of Insurance commissioner lately and talked to them about getting MLR out or getting agent commissions outside of the MLR equation, you need to do that today. In talking with the carriers, if they could get that done, you may be able to do a lot of work towards saving the fully insured market. That may be the difference between some of these smaller carriers surviving and not surviving, and the difference between the mid-sized carriers being able to continue to pay you what you're worth and being able to pay you what the federal government dictates. So definitely a lot of discussion on that, and I'm hopeful, but I just don't know. At this point, anything's possible. So stay on top of that one. Reach out to your Department of Insurance commissioner. Are there companies offering alternate funding in Oklahoma? Again, I believe the answer to that is yes. There are some state restrictions, so you need to talk with one of our employee benefit specialists here about what they are in your state. Some states do make it a little bit more complicated, but I do believe the answer to your question is yes, we definitely have product in Oklahoma. In fact, it's one of our better states. I think that's it for questions. If you continue to type them in, I'll try to answer them to you afterwards, but as it stands, we are at 9:45. our time, 10:45 Central, and I did want to get you off the line and let you enjoy the rest of your week at this time. So I'm going to conclude the webinar. 800 number is up there. I hope you've enjoyed today's session. Hope you'll reach out and call my staff. They're ready and willing and able to help you in any way that they can, as am I and the rest of our management team. So have a great Thanksgiving. I know from our perspective we are thankful to have you as part of our business, and we hope to do even more to help you be more successful in the coming months. Thank you very much.